We are improving our management of patients with cardiovascular disease, but there is a trend at this moment to move into the understanding of health and preventing disease. It's a very important trend on economic basis and otherwise. And I'd like to talk for a moment about two challenges that we have at this time. The first one is the evolving role of technologies, which is fascinating, and I will present to you some data. And I'm talking about health and prevention specifically. And the second is the need for education, and certainly, I believe, for primordial education. Now, let me start with the evolving role of technologies. And the problem here is that we believe we are fantastic, the cardiology. Sure, this is the decrease in mortality over the years. But look what is happening. 2020, the mortality in men is almost equal than it was in 1985. And this is beyond the increase in population or getting older. I could present to you the data. This is real data, that what is happening. So about a few years ago, we decided to move from investigation of disease, particularly cardiovascular disease and arterial disease, to the understanding of health. And this was a movement that was very interesting because first was on technological basis. What we decided to do is to move from disease towards health with the new technologies evolving, imaging, genetics, new therapies, artificial intelligence, and trying to understand how the disease begins. Maybe if we understand that aspect, we might be able to treat the disease better. And we began to, there are three different ages here: birth to age 20, age 20 to 60, and age 60 to 100. But technologically, we began with age 20 to 100, and I just want to summarize. This work has been done in this institution and in the National Center of Cardiovascular Investigation in Madrid. And let me begin by saying that we have studied 10,000 people, apparently normal people, between age actually 20 and 50. And I'd like just to tell you the 5 findings that have been published this last year. So this is long-term studies, but the data is coming out now. First, we began to do 3D ultrasound of the 2 carotid arteries, the aorta and iliofemoral arteries, an automatized system that will be available for the public probably in a year from now. And what we found is subclinical arterial disease begins at age 30, in particular in the iliofemoral region, and is very frequent. Second, this disease that is subclinical progresses at a rate of 33% at 6 years of follow-up. Most importantly, risk factors at young age, between age 20 and 40, have much more impact on the reactivity of the arteries than it is later in life. So this is extremely important, the impact at young age, in terms of progression and eventually events. Interestingly, and I think this will be published next week, we found subclinical microvascular dysfunction already at a relatively young age in people with diabetes, hypertension, and hypercholesterolemia using magnetic resonance imaging and stress testing. Fascinating, the issue of microvascular disease. And finally, the guidelines are absolutely primitive, in my view, today, because they are all based on clinical events, but not on subclinical disease. So usually you go into a formula at age 40, 50, 60, about the 10-year of Framingham, and see what happens, when in fact 10 years is nothing, but the whole thing starts much earlier. So I think I can predict this will go much earlier in terms of addressing individuals beginning at age 30. And I don't think it's going to take too long to move into that stage. Why? Because we now have very good data that subclinical disease predicts events later in life. Number 2, acute coronary events. And it's very interesting, you know, the bone marrow reacts to the deposition of cholesterol in the arterial system. And we work on 900 individuals with positron emission tomography, which identifies in the large arteries the interaction we call a war between monocytes from the bone marrow and the cholesterol. And basically, it's a defense mechanism to take the cholesterol out. Any foreign body brings monocytes into the system and leukocytes to take care, infections, COVID, wherever. This is cholesterol. But what happens is, if the deposition of cholesterol is not very significant and the risk factor profile is low, the winner is the monocyte. And with magnetic resonance imaging, which we did in these 900 individuals, what you see is a healing of fibrotic phenomena. This is fascinating because this has been seen at autopsy, but never has been done in vivo. Well, but there is a problem. If the deposition of cholesterol is very high, the war is lost, and the monocyte decides to commit suicide, which is called apoptotic phenomena. And it's in our view that that's the key of the acute coronary syndromes, is a battle that is lost. Because during the apoptosis and the killing of the cells, of monocytes by themselves, they release toxic materials, metalloproteinases, that may cause plaque rupture and tissue factor, which may cause the clot and leading to acute coronary event. So our present concept with all these new technologies is that acute coronary syndromes have a lot to do with a defense mechanism or a war, and the defense mechanism is a failure because the substrate is very significant. And finally, about genetics, I don't have to go into the details, but we find 25% of the adults, the cells that are supposed to defend us are mutated, and this is called CHIP. You probably heard about it from the bone marrow. And what that happens, then the inflammatory process is very significant with these cells that are completely distorted. What I'm really trying to explain to you, this is all done in apparently normal people. And these are technologies that are very sophisticated technologies, telling us things that actually can make us to understand disease better. And finally, about the elderly people. Well, we have now 1,000 people that we are following very precisely with technology applied to the brain, MRI flow and structure, positive emission tomography addressing the entry of glucose into the brain, 10 tests of cognitive dysfunction, and new biomarkers like troponins that now are telling us when the brain has a slight damage. I don't want to present any data here, but we already have information suggesting, and this is being published at this time, that actually the same risk factors that affect young people in cardiovascular disease with 3D ultrasound are affecting the microvascular of the brain with intimal hyperplasia and decreased flow and decreased uptake of glucose and cognitive dysfunction. What I'm really saying is that all this technology in the last few years now is crystallizing into one concept, that the same risk factors that affect young people not only is the most critical age that we should address the issue of prevention, but can also eventually affect the brain with cognitive dysfunction and acceleration of Alzheimer's. This is just a summary of the technology that we have used over the last 10 years, and now the data is coming out at this time. Well, this is how we started, but the mortality continues. So the problem, and I think is some kind of a frustration, is when you work in research and trying to make things better, you realize that things are getting worse. And the reality is we have to be aware of this. I think we are advancing cardiovascular disease, we are advancing tremendously, but there is a problem. The mortality is increasing. And the question is why? Well, we got together with NIH and the Institute of Seattle that they look at quality control. And this is actually 1980, 1990, and this is the year 2020. Do you know what is in green? It's the cause of increasing mortality, obesity, hypertension, and diabetes. All together is actually the metabolic syndrome. And there's no question about it. This has been looked, and we look at this every year. So the question is, with all these technologies, everything is fantastic, but something is failing. And that is the risk factor profile is increasing with the will of consumption. And the question is winning? And that's the problem. So having said that, Now let's, for example, talk about obesity. This is the change in obesity at the year 2000 to 2014 in the adult people. But this is in the young people under the age of 18. And now we know that 75% of the obesity in adults actually starts in young age. So we move into young age constantly, regardless of the technology or anything. And that's the issue that I'm trying to present this morning. And that is, if we don't pay attention at young age, I don't think we are doing a good job here. Well, having said that, this leads to the issue of education. Of course, we move from technology to see people understand that we have a problem. Well, it's interesting that this led us to move into birth to age 20 to see what could be done in terms of education. Well, it's interesting. This is my brother, who had a tremendous impact on me. He's a neuroscientist at UCLA. And actually, he's one of the pioneers in frontal lobe function. But he has a concept that is now being proven that is very important, and that is whatever you learn in the first 10 years of life carries through adulthood. So the question is, look yourself today, and you will realize how important was the first 10 years of your life in the environment that you were, the family and otherwise, how we are today, how we react to these things. Well, with this in mind, we thought maybe we should infuse the importance of health in children, and this might pay off when they are adults that will take care of themselves. And that was really the concept. Well, and we did. And actually, we started a project which is actually worldwide, and we are dealing now with 50,000 patients, not patients, children, you will see in a moment. And it's all in randomized studies. And I'm going to be presenting to you the data that is evolving at this moment. The question here is, a child has very few centers in the brain, and therefore whatever you tell is stored. What in adulthood is a chaos, the density of the receptors is very high, and you do not capture everything that is around you. That's a big difference, and that's where my brother contributed to this. Well, the question is, can we then try for this teaching at young age for these children to store that health should be a priority? And this has been the main, actually, driving force for the project. Well, I'm going to be presenting to you the 4 first results of the project, starting with 5,000 children. The study started in Colombia, Bogota, children 3 to 5 years of age. And it's interesting to add that I tried to study in New York, and the Board of Education said, I don't know what you are talking about. So this is why we end up going to another country. But that's the story. I still remember the day I presented my hypothesis to the Board of Education here. We started in Colombia in children 3 to 5 years of age. And actually, the children were randomized, over 1,000 children. They were randomized into the top. 50, or half of them, how the body works, healthy food habits, physical activity, and we told them how to control the emotions, is self-esteem. When you are older and you are confronted with alcohol, drugs, and so forth, you will be able to say no. Very important to create self-esteem at a young age. This is something that we are learning. And the other group served as control. And this was 60 hours over 6 months. All these studies, by the way, were completely blind in terms of the results and so forth. I don't have to go into the details. Well, the results were extraordinary. This is actually knowledge, attitude, and habits in these children following this intervention. Then, because of the results, the American Heart Association gave me a grant to come to the United States and begin here. And actually, we started in Harlem, socioeconomically much lower than in Bogota, in Colombia. And this is the family trial. The family trial involved 562 children. Maybe some of you participated. 562 children in the school system in Harlem. And the same thing, age 3 to 5, and 60 hours of teaching over 6 months on the 4 aspects I mentioned to you. And the children were divided in intervene versus control. And the same thing, the intervene group in terms of understanding habits and so forth were much better than the group treated as controls. But there was an issue. In children, you cannot measure biology. You cannot measure how much they smoke at age 7 or blood pressure, so forth. But we decided to get into obesity because it starts in childhood. And actually, we did this in Madrid, in Spain, which children 3 to 10 years of age. I am now teaching here. There are 1,000 children actually here. Well, the results were published just about 3 or 4 weeks ago. And it was fascinating. Almost 2,000 children in which we did the intervention I mentioned to you, but we were able, they're older, we were able to measure fat with all the technological approaches of measuring fat, the belt, the BMI, and so forth. And the results were just published. In blue, actually, is the fat deposition in the group that were not intervening, the controls, and this is the control group. So for the first time, we now have evidence that you can affect the biology of children other than knowledge, attitude, and habits, which is what we did before. Well, this is the third, but now comes the fourth, and that is research has ups and downs. And now I'm going to tell you the news of all these studies together, Bogota and Madrid and Harlem. And this is the story. We teach these children, and everything goes well, attitude, and so forth. And then we measure BWAT, is a score. Blood pressure, exercise, weight, alimentation, and tobacco. And we go on and it's 10, 12 years of age. Well, they lose part of what we told them. Very frustrating, isn't it? It's like the hypothesis is not working. But we thought maybe they have to be reintervened. I will get into this in a moment. What was fascinating is the control group in the school system. They do much better than what we might have expected. And what it's really telling us that the environment is critical. If you have an environment that is something to do with health, people smell something is going on and things get better. So I presented to you the 2 issues here. One is, should we reintervene? And the second is, what about the environment? This led us to 4 projects that I'm presenting to you now. Remember the children in Bogota, 3 to 5? Well, we follow them. We follow them until age 13. And the question is, we reintervene them at age 10. And the other group that was control, we also intervene at age 10. So there were 2 interventions. The first group at age 3 to 5 and at age 10, and the second group at age 10. These are the results. The reintervention is absolutely exponential. That is, they lose because the society, they get into the school system, but if you reintervene, boom, it goes up. So whatever you did at younger age really plays a role, which actually led us now to say how many times we should intervene before age 20. Well, this is project 1. And we just started this project. One is in New York and the other is in Madrid. In Madrid and in Catalonia is about 45 schools. And you see what we are doing. In the top, you see, is the group that is intervene and is intervene again. And the other group is only intervene once. This is reintervention, R. E is intervention. And this is booster, that is, we do small interventions. And this is the group of control that is only intervene once. Okay, and this is actually the study that we just started in the Bronx, in New York, socioeconomically very low. We are interested to know that. 1,300 children and 50 schools. And here we have the same thing. A group that is intervened and then is reintervened with small interventions in a group that serves as control. So now what we are trying to do in a randomized studies is to see how many times you have to reintervene at age 20, that you have impact, not only on the formula, actually, because they reach an age that you can already measure a number of things like obesity, blood pressure, tobacco, and so forth. So this is the second project. The third project was a real surprise. It was based in the environment. I mentioned to you that the environment is so positive. Well, I can tell you, very positive. What we decided to do is to develop a program for the families. The families means that the 4 aspects that we presented in Bogota, understanding how the body works, active lifestyle, and healthy eating, and controlled emotions. You have the parents, the children, and the grandchildren. Over a period of 1 year, they have this program with different degree of maturity depending on the age. But the format are the 4 aspects I mentioned, and it's very visual. Well, what we did is we presented these in corporations, banks, and so forth with the people that were there. An absolute success. That is, they all get involved, and it's the environment, it's a family environment. And then what we decided in Latin America, to go to the waiting rooms of patients that are waiting. And we actually studied over 10,000 families, all very positive. And that is, you present in the waiting room what you are doing. Do you want to participate? And then we get into the families over a period of a year. Very, very successful. Well, this leads to the issue, as we wrote in Jack very recently, that as much as we are involved with technologies, advances in medicine, which are absolutely essential, we are beginning to understand that education is absolutely critical here. And to me, the adults, I don't know how far we can be educated, but children really can. So we believe strongly into a movement towards global primordial prevention in the school systems, in the family, and in the patient's waiting rooms. Well, you say, this is fine, and so next. Well, we're going to start this actually, and we have a complete map now of what we are going to do. This is actually starting in New York in the left, in the whole of the United States, and in Latin America. And this is the program that we have traced over the next 10 years. So basically, what I try to present to you today is that we should continue to develop technologies, not only on disease, advances, and we are excited every day, but new technologies in understanding health have given us a clue that something should be done much earlier, that is also education. And certainly, if we talk about education, it seems, scientifically speaking, that primordial education in children is probably will have the best benefit. And I just finished with these 2 paintings, which is interesting. You know, Matisse and Picasso were in a fight. Interestingly, Matisse was rather negative about the heart. You see, there is a heart in this painting. And saying, he was talking emotionally. The heart in our emotions is a lot of problem in our lives. That's the way he's looked at. And it's interesting, he's Picasso, which is completely the opposite. This is a heart and this is the brain. And I say we should be positive. And that is here, I would say, we can say disease is evolving and we have to do something about it. But he is completely the opposite. When we talk about the heart, also talk about the brain. I mentioned to you how the brain has the same risk factors in the heart. But at the same time, the issue of education, it actually Picasso paid a lot of attention to it. So it's just a summary with 2 paintings at the same time of 2 people who had different points of view. I think today we have to really fight against this, and let's move forward in this. Thank you very much for your attention.